I was diagnosed with pressure and I'm taking medications from the hospital. But recently, they told me the headaches and dizziness and body weaknesses were a result of side effects of the medicine. What foods can I eat to minimize the side effects? Ekalam Ruth, she is in Soroti. She is on drugs for pressure,
yes.
And the drugs have caused side effects.
Yes.
She wants to stop the side effects.
Okay.
That is if I have understood the question.
Yeah,
well.
that's right.
What foods can I eat to minimize the side effects?
Ruth Ekalam. Let's start from the beginning. You have got side effects of the medication you are taking. Why are you getting the side effects? Because you are taking this medication for pressure.
Yes.
Why are you taking the medication for pressure?
Because
you develop high blood pressure.
Patient of pressure.
So, there is no food that is going to take away the side effects. That's one thing. But, however, we have to go back to the root cause.
Which is pressure.
Which is pressure. And we see how, so what you have to do is, you have to come to Timex Nutrition Center. Then we tell you what foods to eat, exercises to do. We shall give you some of the supplements. Then eventually, your pressure, you continue taking the chemical medications, but the dosages will go being reduced by the time you go, because now the pressure will start going. Because the root of cause, Ekalam, there is no microorganism which causes high blood pressure, number one. Number two, there is nowhere in the world where they vaccinate against high blood pressure. We looked at pressure the other time. The pressure of a human being is given by arterial resistance, the resistance the blood finds going through the arteries and the veins, times the cardiac output per minute, the rate at which the heart is pumping. So these are the two factors. And we saw that arterial resistance, yes, why do you have resistance in the arteries or the veins? We looked at atherosclerosis, that is when you have a lot of fats going, because of eating wrong foods, fat starts going on clogging in the veins and arteries. Then you look at arteriosclerosis, whereby the veins just be hardened because of taking wrong calcium.
Yes.
Then they can no longer dilate when the heart pumps. Then we looked at salt intake, which increases fluids through the veins. We looked at things like excess fluids in the blood. If you are taking too much water, that can increase your pressure, because you have all these fluids you have to move through the arteries and the veins.
Yes.
Now, that one multiplied by the cardiac, the rate at which your heart is pumping. Now, when you look at all that, all those things are caused by wrong foods, food is not compatible with blood group, and wrong lifestyle strategy. That's when you come to Timex Nutrition. We tell you the foods to eat, then exercises to do to keep yourself fit, and also the lifestyle strategy to adopt. How would you avoid stress? How should you handle stress? Because stress is one of the things that are going to cause you the heart to start pumping irregularly. So when you come, we shall handle that. Then these medications will go on being reduced. Then eventually the side effects of the medication will go away. But otherwise, you cannot think of eating foods to remove the side effects when you every day you are busy taking things which are causing the side effects.
In fact, you can't think about how to handle side effects when you actually can solve the whole problem.
Yes, exactly.
The mother problem of taking the drugs which lead to the side effects.
Exactly, that is that.
Okay.